So fatigue has been a big concept for our patients, and we actually just did a major town hall and other research about this. So wanted to at least have something here as a video for people who can come to us in our visits and maybe not to us. So fatigue is actually the most common symptom of our patients with orthostatic and autonomic. So fatigue is something we talk about often, and fatigue is something people say, I feel tired, I feel fatigued. And at some level may seem very relatable, understood, um, and easy to get, but not, because fatigue is not often as I'm tired. It's not a sense of if you take a nap or rest in the sense of an autonomic disorder that you will feel rejuvenated. So fatigue is an experience as a person where people really struggle physically, cognitively, emotionally, spiritually, and existence or existentially through their day and experience. So it is the most common autonomic experience. So one would think with orthostatic, where you cannot regulate your blood pressure, it would be fainting, but it's not because most people have enough sense to say, sit down, lay down, you're going to faint. They learn instinctively to avoid that. But and fatigue is a very personal description and experience for a person. So the best way to understand fatigue is ask somebody, how do you feel fatigued? And again, it's not relationship to sleep. Um, it's how they feel go through the day. It could be for a person, I have trouble executing, getting my activities done from hygiene, chores around the house, their work, and their other experiences. And again, it's not just a physical activity, it is a cognitive and experience of through their consciousness, emotional, physical, spiritual existence, and physical. So that's an important relationship. Um, the first aspect where it can happen is we call preload, where your heart is a pump, and the heart is fine for most of our autonomic patients, the majority, overwhelming amount. But the heart's a pump and getting blood vertically up. Our patients with autonomic orthostatic have a problem getting blood vertically up, called the preload. Pumps the heart, and then after pumps the heart is called the afterload. So generally in hypertension, there's a resistance or challenge with afterload. But orthostatic patients have a problem getting upward, the preload. That preload creates that sort of orthostatic issue that can lead to fatigue, wooziness, brain fog, exhaustion, that sort of reduced blood flow vertically up to the head, which are some of the hallmark symptoms of fainting, dizziness, lightheadedness, wooziness, scattered thinking, whatever word you want to use. But that preload is the beginning phases of people in their disease state historically where they start of feeling fatigue and even through their disease. So that preload. So that's why all the treatments from hydration, salt, stockings, if it was that easy, it would be the only treatment, and it doesn't always work. Medications, and then often using treatments for the sympathetic overdrive to help this condition, to reduce some of those counterbalance, can overact to work against people. That sympathetic response can over exaggerate and cause many challenges. They can almost impede recovery because too high of a heart rate can reduce heart pumping effectively and also impair thinking. So that's a big aspect. Another aspect of fatigue is energy conservation. So energy conservation is a big deal. Is how do you go through your day? A normal person such as I can go from point A to point B well without thinking about it. It's a given. So picture somebody who has a health condition. It's like going through point A to point B with a major weight. Picture a 40-pound weight on my back now, going from point A to point B. That is a hindrance. People with orthostatic issues, autonomic disorders, there's many barriers to get through. So they have sweating issues, gastrointestinal issues, their blood pressure being maintained, and there's barriers. So for them to go to point A to point B, they have challenges. Things will start to decline and hindrances and barriers. So their energy will decline. So that leads to fatigue. And with that fatigue is that their body can't maintain itself to get at point A to point B. It could be temperature regulation. They can't maintain their temperature. The external world maintains challenges. if it's too hot, too cold, as they can't maintain their temperature internally. They can't maintain their blood pressure as they go through the point A to point B. So that can lead to fatigue. Aspects of their gut function and their urinary function can impede their functioning. So that needs attention as they go from point A to point B, that they need to take care of those aspects of gastrointestinal or urinary, getting from point A to point B. Sympathetic overdrive kicks in, so the heart rates go up and they get more scattered thinking because that high adrenaline interferes at point A to point B. The other aspect is if someone's normal, doesn't have a health issue going to point A to point B, it does not require any conscious thought. But if someone actually has a health condition to go from point A to point B or activity they need to complete, someone with the orthostatic disorder or autonomic disorder requires much more attention. Okay, if I need to do this activity or go from point A to point B, these are all the things I need to do and be conscious of to do that. So that constantly wears you down. So if a person who has an autonomic disorder, neurological disorder, they have to be very aware of, I need to do this activity or get from point A to point B. I need to make sure I hydrate. I need to plan how I walk. I need to plan this, how I use my energy, how I do this, how I do that. And it's that constant mind attention wears you down. There's this aspect of direct attention fatigue um, that really is ties into brain fog, that the constant need to pay attention wears you down cognitively and leads to brain fog, that you need to sort of play that constant tension as opposed to a person who says, okay, I'm going to go to the grocery store and get groceries, who doesn't have a health issue. They can go through the store, have their list, and get the 5 or 10 things they need to do. Versus a person with a neurological disorder, autonomic, I need to get those things. I might need to plan how I physically move, rest, deal with the temperature. I might have bowel bladder issues, gastrointestinal issues, urinary issues. And getting through that list and that physical space, I am very consciously aware of what I need to do, intending to my body because it's dysregulated. That constant tension wears you down and leads to not just physical, but that brain fog, that constant tension. We're not always meant to be so attentive all the time to our bodies and our surroundings more than you realize. And that leads to fatigue. That's another aspect of fatigue. The other aspect of fatigue is generally we're not so aware of our self through the day. We wake up, we're tired. Usually for normal, you sort of clear your mind, you wake up through the day, you get hungry, you get tired, you have to go to the bathroom. There are those normal body signals, but the interoception, there's that signals through the day when you're sick, the pain, the discomfort, the dysregulation, the temperature challenges, the nausea, the bowel issues, the bladder issues, the heart rate, the sympathetic symptoms, the adrenaline symptoms, that constant signaling and the awareness wears people down. So people with chronic health issues will have more fatigue because of that constant alertness of their body signaling their nervous system, that signaling you don't really escape that state of being. So that's why a lot of the work for um, planning your day, what can I do to get through this activity? How do I do things? If I need to do this, how can I use my energy correctly? Then also is all that wellness maneuver to do distraction or getting more vagal tone or helping with pain management, helping with care management to get that signaling down of your body's constant noxious toxin signaling to you will help to give your brain and your mind less awareness of all this sort of reminders of how sick you are because sick body makes sick brain, sick mind, and it has a reciprocal response in that regards. So that's another aspect of fatigue. Fatigue also can be medication effects, nutrition. A lot of those aspects, can do this. A lot of patients, due to their gastrointestinal issues and their nausea and their barriers to really economically and to also meal prep. It takes a lot of energy to meal prep and get food at the grocery store, even Instacart can be challenging to get the food from the door to the house. Those food delivery services, our patients have issues, so that can tie into our patients develop nutritional issues can tie to fatigue. There is a thing called the spoon theory, is that how many spoons you have in a day and you use it up, you're done. That theory has been very wonderful because it creates this alertness about you have this capacity in a day and then you're done, you're done. You have this reservoir and you're done. I think one thing that's with that is challenge that limits is it still puts a little too much on the burden on the person without understanding where those spoons come from. So I view it much more of a recipe of someone's energy, almost like a cake, that you actually are trying to make a cake of your energy. And to understand what is that daily recipe for your cake, your recipe, like there's flour, there's eggs, there's salt, there's sugar, there's maybe oil or butter or milk, what goes in there, and that's your energy. And not all those aspects of your energy supply are intrinsic to you. That you need a certain amount through the day to get this, but sometimes you might not be able to get those eggs. There might be factors that are out of your control that you can't get the eggs. There's called social determinants that are transportation issues, economic issues, education opportunities. There's barriers of cultural that create hindrance for people to have things. And they're very huge impacts. So it's important to talk about the fact that people's energy conservations have to be taken in context that things happen to people that their energy supply is not always that they have a supply that's to them by themselves, that there's things that are external that influence them. So that's an important aspect of the spoon theory, though it's wonderful. It creates this awareness that we need to understand that there's things that are happening to people that are not always intrinsic or onto them or responsible to them. I think it's an important idea to realize you have this limit that what you can do in your day and what your threshold is and your capacity. But there's factors that are also, when we look at a patient, and I know when we look at a patient, that we understand that there are many barriers that say this person might not be able to get through their energy because there's factors beyond their control. So it's more of a recipe than necessarily a drawer of utensils that when you're done, you're done. So that's another aspect of that. So I think we covered a lot about fatigue as an idea, but I think is mapping out your day, realizing there's many factors, using autonomic care, looking at factors beyond your control, setting limits for yourself, having mercy for yourself is important, is so important. Having compassion and understanding for yourself that this is a challenge and really being kind to yourself is such a key point. Thank you for listening, and we believe in you.